Hi, I'm Dr. Siegfried, and thanks for coming to my YouTube channel. I'm a chiropractic physician practicing bilateral nasal specific techniques since 1976, having spent over 1,000 hours with the developer of the technique, Dr. Richard Stober, who developed, taught, and practiced it for over 45 years. I myself have personally done thousands of the procedures myself, and today I'm going to be talking about chronic sinusitis and some of the problems that go along with that. Chronic sinusitis can mean many things, but for example, a recent case that I have that I'm working on right now, who's a patient with chronic sinusitis and was supposed to have sinus surgery. And of course, if you have chronic sinusitis, you're going to be thinking, what can I do? Maybe I don't want to have surgery. But you also have to realize that the bilateral nasal specific technique, as dynamic and as fantastic as it is, that might take a little while to help you get back to where you want to be. But it's certainly not a surgical procedure, and it certainly doesn't have the dangers of surgery, but it does have the opportunity to get your head and your sinuses cleared out the way you want. For example, in a CT scan that I have here, or a CT report, this patient has chronic sinusitis, but they also have polyps, retention cysts, membrane thickening, and some other terms like that, which means that they've had it for a long time. And it's similar. The analogy that I use is like the sinus, this fluid, because it's not draining, literally gets packed down in the sinuses. So it's kind of like driving around on packed dirt. It doesn't move, and this procedure opens up the head, takes the pressure gets the sphenoid bone moving, opens up the head, takes the pressure off the brain, and literally gets this brain pumping the way it should be, like this, so to speak. And in doing so, it gets the nerve supply from the brain, gets the pressure off the brain, gets the nerve supply, what are called the cranial nerves coming out of the brain, functioning to the, actually this guy couldn't smell, he smells very poorly as well, but it gets which is already improved, by the way, just after a few visits. The brain starts pumping, and the cranial nerves, which go to what are called the cilia in the sinuses, it charges them up, so to speak, and then they start doing this, just like you would in a car when you get your car washed. It's like flapping back and forth to get this material flushed out the way it should be, which is the way nature designed it. But in this case, because he's had so many head injuries, head blows, he played soccer, he boxed, he wrestled as a kid, played football, and who knows how many other bumps and thumps he's had. But at the age of 43 now, he was told he needed surgery, but he's not going to need the surgery now. The point I'm trying to make is this. We get the bones of the head adjusted, get them moving, get the pressure, get the sinus, get the sphenoid bone moving the way it should. The brain starts pumping the way it should. The energy starts going to the nerves, which regulate what are called the cilia in the sinuses. And then they can start doing their job of draining, which in this case is happening very fast with this patient. He'll need some treatment, but at least we've got the ball rolling. And when you start this process, it's not uncommon for you to have a lot of drainage. Drainage think of it this way, you're draining a swamp. And all kinds of stuff are in there. All kinds of green, yellow, orange, old blood. A lot of different things can drain out of that. And you don't have to worry. You just need to know that when I perform the procedure, that's a normal process to occur. It's very cleansing, and the patient is very happy. But the point, again, I just want to make this point that when you have a chronic sinus problem, this procedure can be very helpful, but there's a time factor to get the body stimulated to do what you need to have it done. You need to have time, give the body a chance to do its job. Thanks a lot for watching.